Hello and welcome to the Natania G Podcast. I'm your host, Natania G, and I'm thrilled to have you join me on this journey towards lifelong health and vitality. With nearly 30 years in the fitness and wellness industry, I've had the privilege of working coast to coast, meeting incredible professionals, mentors, and leaders. My goal is to bring their expertise to you, offering not just information, but practical tools you can apply in your own life. On this podcast, we'll interview a variety of professionals, each with unique approaches and specialties. I believe everyone is unique, and what works for one person might not work for another. True success happens when you match who you are with what you do. My next guest is Dr. Liesel Orend, who is a versatile healer and merges Eastern and Western modalities to support holistic health. As a licensed chiropractor and acupuncturist, Dr. Orend offers a wide range of therapies, including craniosacral therapy, visceral manipulation, acupuncture, and nutritional counseling. She has such a passion for learning and a dedication to helping others. Dr. Orend combines cutting-edge techniques with traditional practices to promote the body's natural ability to heal. She holds a Doctor of Chiropractic and a Master's in Acupuncture and Oriental Medicine and is deeply committed to improving the well-being of her patients. In this podcast, we'll hear from Dr. Orend on her approach to treating her clients, more specifically with visceral manipulation, and also her passion for working with children. All right, Dr. Orend, I'm so excited to have you here. You're one of the first people I wanted to get on here because, my background is, from the fitness health industry, and body work was new to me when I started studying it, and opened up a whole new realm for me, which I continue to be on a journey. And one of the beautiful things I noticed about what you offer to clients and to patients is you are a doctor in chiropractic, you are acupuncture, but you also, I know there's a whole other list of things we can go through, but you also specialize in something known as which I did want to highlight, visceral manipulation. And I wanted to talk a little bit about that because I don't think it's really well known. I know it's well known possibly in the bodywork realm. I don't think it's well known in the fitness health industry and how impactful it can be for people's health and overall wellness. And I think it's really a missing component. So you really shine in this area, and I look for you for guidance. And I'd love to share, the tools that you've shared with me with other people. So I guess my first question for you is, what the heck is visceral manipulation? It sounds really,
Visceral manipulation is manipulating the organs, basically. So working on the viscera directly. And we have in this country, we've been really blessed to have an osteopath named Jean-Pierre Barral, who has made his life's work sharing with us these techniques. The osteopaths have had techniques to work with the viscera for a very long time, but they're not really available to other body workers, other kinds of disciplines. But here we have a very large library of techniques thanks to this man.
Right.
And that's where I got my education, is largely through that.
Yeah. What was your first experience with it, with visceral? Like, how were you exposed to it?
So when long time ago, when I worked at the Rolf Institute as the education director, I had a kidney issue. And my husband, who was not yet my husband, but a faculty member who became my husband later, asked to work on my kidney. And so he put his hands on my kidney, and I could feel my kidney moving in response to his touch. I don't know that I'd ever felt my kidney before. And I don't know that I had any idea that one could work with a kidney. Obviously, I had a lot of information about Rolfing, and I had experienced a lot of different kinds of body work. But I was blown away that somebody could directly work with and impact a kidney. Never thought it was possible. And that piqued my interest.
Why would, like, for the average person listening to this, how would I know I have a kidney issue? Or what could it show up as in my body that I know I need to have it? Oh.
So in this case, I knew I had a kidney infection. It was clearing up. So it was a clear sign. But other people might not know that they have an issue with their kidney, or that their kidneys might be stuck or not moving appropriately. In that case, we would find it through the process of the bodywork session.
Okay. And how would it show up in the body? What would make you lead to touching in with somebody's kidney? Would it show up in the body as something else that would lead you to it?
Could be low pain, for example. People have sometimes achy, non-specific pain in their upper low back. That could indicate a kidney issue. It could be a lack of mobility. The kidney, as it sits in the body, sits right on the psoas muscle. So sometimes if there's a lack of range of motion, the kidneys could benefit from a little contact.
And we can do this with all of the organs. You're able to sense a mobility. You're saying, what is that exactly for the listener? Like, what do you mean by mobility? It might not have mobility when it comes to our organs.
Everything in our body is designed to move. We move, right? So as we move in different ways, the organs move with us. We're pretty accustomed to thinking about the way our muscles move, maybe about how our ligaments move and our tendons. We may not consider that our organs go with. So every time you twist your body, the upper thorax, that includes your heart, pericardium, your lungs, your esophagus, everything, your trachea, everything that's in your upper body has to move.
Okay, so so sometimes it can get stuck, just like, for example, a tight muscle might get stuck.
Yes. Right. Also trauma, for example, a car accident. Seat belts are a very common way for those restrictions to occur.
But you also have a doctor of chiropractic and acupuncture. How do you combine these in a session? If somebody was to come in to see a session with you, how are these combined? Do they get all of them? How do you determine where to go? What's your intake process like?
It depends. So somebody might come in with an issue, say a digestive issue. That's pretty common.
Okay.
And often people will come in with a combination of things. So say they're coming to see me for neck pain.
Right.
They may also say, oh, and I have GERD. Right. I have this digestive problem also. So I will check it out as a part of my process. We'll work on the neck, but I'll also check the whole body. There's a technique that's pretty important that Jean-Pierre Barral, again, shared with us, which is called the general listening. I don't believe he coined the term. It's the general listening, where we put our hand on top of the head and we find the restriction in the body that's giving us the most information at that moment.
Yeah.
So that is important because it basically means that the body is telling us what it needs.
Right. I remember that technique. I'm going to a course on that in a couple of weeks.
Yeah.
Through going through these studies now, you've done visceral. I think you're studying the brain now. Can you talk a little bit about that? Because I know a lot of your work has been inspired by your son. I know we've talked about that. So you've gone into neuromanipulation, visceral manipulation, and the brain manipulation? Or is it called something else? Yeah. Okay. What does that, and that sounds so fascinating. Do you want to talk a little bit about that and what you're doing?
Sure. So first of all, it works with all of the things that impact the brain. All of the structures around the head are going to have a strong impact on the brain. So the eyes, for example, strongly impact how your brain is functioning. The jaw, the ears, the mouth, all of that, the nose, because the connections are so close and so direct. But this is Jean-Pierre's last great work, I think. And it took him a long time to be willing to put it out to the public in a coherent way, because it is more vague. The least is known about it. Even that's across the board through all the disciplines. We know less about impacting the brain through touch than say muscles, certainly viscera, right?
Yeah.
But it's a fascinating domain for me. I've just taken my second class, and it really relies very much on that listening to be able to feel where there is a restriction in the brain.
What would somebody seek this? What would be a reason why somebody might come to you for this type of service that's listening to this?
It would be anybody who has some kind of an issue that is not resolving through other means. For example, something like someone who's had a concussion, or someone who's experiencing a lot of brain fog, someone who's having post-COVID difficulties with their mind. Could be somebody having developmental problems, a child.
Right.
Work a lot on kids. Things are not connecting correctly.
Right.
So this technique, these techniques are something that you would add to your therapies.
Got it. So this kind of picks up where, in some ways, Western medicine has left off, we could probably say. Possibly, maybe not. Or does this work pick up a little bit where it's left off?
I would say yes. I mean, thinking back, especially to the visceral manipulation, that is very much the case. So Western diagnostics are amazing, and they can look, for example, inside the tubes. If someone has a digestive issue, you can get a colonoscopy, you can have an endoscopy, and you can see exactly what is going on the inside of your body. But we don't look at the restrictions on the outsides of the tube. So what are the things that are binding or keeping things from moving appropriately, which then end up keeping them from functioning appropriately? So we need to take a look at that through a different way. And visceral manipulation is a great way to do that.
Yeah. I remember when I took a course first time and we were going through the intestines, the large intestine specifically, and I was like, why have I never been taught to palpate my own large intestine? Like, why are we not taught about this? And I found it really fascinating. You know, I was like, if we have the ability to be able to connect with this from within ourselves, like how much disease can we possibly prevent in the future if there's some type of like adhesion or stagnation or something not moving properly? We know when something stops moving, you know, a whole bunch of things can happen. So is this something that you also offer in your practice? I know you work with children and you teach moms how to work with their children. Is this the type of thing that you would also go through with somebody if they came to you and maybe were having digestive issues? They would learn, you know, how to be able to possibly feel it themselves and be able to help themselves in the future?
Yeah, to a degree.
Okay.
So one of the things that first attracted me to the visceral manipulation is how specific it was. So you, as a practitioner, you really focus on the anatomy and you learn to find the exact structure that you're trying to address. That is not something that can be picked up quickly or easily by anyone.
Darn it. You mean I have to keep studying and learning? Okay.
That takes a little time.
No
but
problem.
that said, there are certain techniques that I do share. For example, with a new mom dealing with a baby that has colic, sometimes I just guide them to help them find the baby's pylorus and put a warm hand, a gentle 2-finger touch in that area. And I coach them. If it feels to you as though nothing is happening, then do less. So use very, very gentle touch to help get that baby's body to understand how to digest. Also, sometimes, you know, there are techniques we can do for ourselves. There are a few things we can do to help stimulate the motility of the digestive system. So that's pretty useful as well.
And when you say, just for the listener, motility is different than mobility.
I was speaking in that moment of your digestive tract.
Okay.
So the ability for the digestive tract to move.
Got it. Okay.
Yeah.
But you had mentioned before the mobility of the organs and now the motility of them. That's different, is what I'm asking.
Right.
Okay.
So I was speaking in that moment of just the digestive system and its ability to digest. But you're right, there is another term within the Burrell work of the organs having motility or sort of an inherent motion that we can palpate and support.
Yeah, which is pretty. Can you give me some examples? Are you allowed to share with some examples of clients that you've seen, so somebody can hear a little bit more about how you approach your work and the unique cases of that you've helped? Can you share a couple? I mean, I think it's really okay.
Sure. So a few recent people. Once someone came in last week, actually, she had bronchitis for a really long time. She'd been sick for a month or so, and she had developed neck pain that was shooting down into her elbow. And it was really clear from the first few moments of working with her that these two things were very connected. So in addition to working on her neck, which, that obviously was helpful, and working on the fascia, working on the muscles, I was also able to work on the nerves through the brachial plexus to help release that stress and those adhesions there, which were causing her discomfort, as well as on the ligaments that suspend the lungs up very close to the neck, and finally on the lungs themselves to reestablish motility to help that clear. Also to stretch the bronchia out a bit. So that's an example of how I intertwine the techniques that I know to help somebody with a problem that's sort of mixed, right? Not just structural, not just visceral, but combined.
That's so somebody has neck pain, working on the lungs. Can you give another example? I just want people to hear like everything that could be possibly connected, because again, I'm still learning about it and studying it, but I do want to get it out there a lot more. So can you give some other examples for somebody that's maybe having some consistent pain, hasn't been resolved with other methods? What would be another example?
Okay. Digestive issues. So that's something that I see all the time. A lot of people have digestive issues these days, right? So someone came in with chronic constipation, had tried medication, had her colonoscopy and her endoscopy, and there wasn't anything there. But she just couldn't get the motility going for some reason and was sort of not able to find a solution. So we worked on I did the listening, and it took me to the liver. And it turned out that by doing some fairly direct manipulation on the liver, lifting it up, allowing for some space, and then also working on the ligaments that suspend the liver and the large intestine, we were able to get things moving again. And her problems took a few treatments. I think it took 3 in total. But then everything picked up. Digestion starts moving again. Yay.
Yeah, you actually helped me with that. I'm not going to go into it, TMI, but pretty incredible. Water, food, everything, just touch, right? Just getting things moving. How do you combine all this? Is there a way that all of these components work together, like acupuncture, chiropractic? I guess you include them all in a session. Does one come before the other? Or how do you determine how to go about a session with a client? What should they expect if they're like, well, I can do any of those? Like, what would they experience when they come in with you? Yeah,
it's really on a case by case basis. So I determine what the client wants to. I mean, that has a part in it, and then what exactly their issues are. I might go to acupuncture if I feel as though there's more of an energetic blockage, as well as a structural blockage. That the acupuncture has associated emotions with the organs for millennia. So there are understandings about what each organ represents. So liver is anger, but also depression, that kind of thing, considered melancholy.
Mm-hmm.
Lung is associated with grief. Heart is associated with joy. So when I address those organs, I'm aware. And if I'm working on someone's liver for the first time, I will warn them that they may have strong emotions. They may have stuff come up. They may be angry about something that they hadn't thought about in a while or whatnot. And just to be aware that that can be a process that's connected. So people that are interested in exploring those connections or working with those kinds of issues, we might combine acupuncture and visceral manipulation. People that are coming in for more of a structural problem or pain in a body part might combine chiropractic and visceral manipulation. It really depends on the person and their needs and wants.
I also saw your face actually light up when you spoke about working with children and babies. I know you've been doing a lot of work with that. Can you speak to some examples why somebody might bring their baby in to see you or their child? I think you're also doing some classes and you do one-on-ones, and I'd love to highlight that.
Okay. Yeah, babies are the best fun to work on. It's true.
I just saw your whole face like light up when you mentioned that. You're like, baby. I was like, okay.
It's the most fun. It's really as much fun for me as anything. Babies sometimes have challenges with digestion. Their digestive systems are immature. So this work can really shine at helping that to function better. But I also work with babies that are having other kinds of challenges. So difficult births, or especially babies that have tongue ties that need to be released. And we work with that, or other kinds of issues, even the problems with the shape of the head, those kinds of things.
Shape of the head. What can you talk a little bit about that?
So that's more in the domain of cranial work.
Okay.
But when babies are born, their skulls have to go through the birth canal. And there's a whole process by which the skull changes shape to in order for the baby to be born, and then in a perfect world pops into place. But sometimes things don't go perfectly and things don't pop exactly into place. Or sometimes later, babies develop a flat head on one side. Maybe they're caught in their neck. And so this side of their head that's lying down more than the other becomes flat. So it's very rewarding to work with a young baby on those kinds of issues because their skull is malleable.
Right.
So very, very gently, you can help guide those bones back into place.
That's beautiful.
That's a wonderful thing to do. Yeah.
Yeah. And I'm sure it's different with different types of birth as well, right? With vaginal versus C-section, I could imagine, because they're not going through actual vaginal canal.
Right. So so that's different. You have a different set of issues. That's all.
Got it.
So if the baby's gone through the birth canal, you might have those kinds of issues. If the baby didn't go through the birth canal, then you have other kinds of issues, which are that the baby didn't get the pressure of the birth canal. And so sometimes needs a gentle push to get the cerebral spinal fluid, the craniosacral rhythm going because it didn't get the pressure.
Yeah. So there's a lot of different things we could take a look at. And I know I just wanted to introduce what you do and everything that you do. And I do want to have you back to go through more application of it and examples. But if you were to give someone that's starting on their quest, they want to get healthier. They know they need to get healthier. They have some blood markers at high risk. They want to take some weight off. They have a lot, there's a lot going on and they're just getting started on their journey. Would there be any advice you would give them based on, what you know and what you're able to offer today?
I really believe that touch is a very important part of our healthcare. So I know that I have benefited immensely from having different forms of touch therapies throughout my life. And I think that often it is overlooked. We take our supplements, we do our diets, we do our exercise. All of those things are super important. But having that input come into our bodies through someone else's intelligently designed touch is phenomenal.
Yes, it is, especially by you. How does somebody get in contact with you in the meantime until we get you back on here? Let's say they want to explore this. some of the things you said resonated with them, they can get you, contact you and schedule through your website, which I will have in the show notes.
Okay.
Anything else they should keep a lookout in regards to getting in contact with you or wanting to schedule sessions? You do virtual sessions. You do.
Sometimes I do.
Okay.
My work is mostly touch based,
Right.
but sometimes I will do a consultation online, and that's totally fine.
Okay.
And I'm on Instagram at
Okay.
Orend Arts.
Awesome. And then I'll have it in the show notes as well for everyone. Thank you so much. I'm so excited that we got this information out there and to see your beautiful face and to get your services out there to everybody. And thank you for your time.
Yeah, thank you.
Okay. I'll see you in a little bit.
All right.
Bye.
Bye.